Hello to those of you who are joining. We will give a couple minutes for everybody to get logged on. Okay, so as people are joining, I will just direct your attention to what is on the slide on the screen. So today's session will be recorded. However, attendees' microphones and cameras will be turned off for the duration of the session. We have enabled live transcriptions, so if you wish to turn those on, you can do so from the Zoom panel at the bottom of your screen. Also, just a note for today, like I said, this webinar will be recorded and the recording will be available on YouTube about a week or so after this session ends. And if you would like to access the slides from today's webinar, you can email us to get a copy of those. And I will post the email on one of these slides later on in the session. Okay, so it looks like we are 1 minute past 1 o'clock, so we will jump ahead and get started. So welcome everybody to today's session titled Spotlight on Students, EIDM Success Stories in School and Beyond. My name is Alana Miller. I'm a research coordinator at the NCCMT, and I will be doing today's webinar introduction. Just a few small housekeeping items to keep in mind. For today's webinar, we have disabled the chat. If you happen to be experiencing any technical issues, please raise this in the Q&A function. And our tech assistant, Christiane Camargo, will address that. My first recommendation, though, is if you do have any technical issues, just log off and log back in. I think 99% of the time that usually resolves it. But please alert us if you're either having trouble hearing or if the slides are not advancing. Secondly, even though the chat is disabled, we will be using the Q&A. So please, throughout the webinar, post all of your questions in the Q&A, and we will address those towards the end of the webinar when we have our dedicated Q&A session. And lastly, we will be running a couple polls throughout the webinar. When these polls happen, you'll just get a pop-up on your screen and you can simply just answer the questions and hit submit, and the pop-up should close. As I mentioned earlier, we are recording this webinar and the recording will be available in English on our YouTube channel. If you would like a copy of the slides, please email us at nccmt@mcmaster.ca. You will be able to, we will send you a copy of those slides. We will also announce on our social media channels on LinkedIn and Twitter when the webinar recording is available. So the National Collaborating Center for Methods and Tools is funded by the Public Health Agency of Canada, and we are affiliated with McMaster University. Production of this webinar has been made possible through the financial contributions of the Public Health Agency of Canada. The views expressed here do not necessarily reflect those of the Public Health Agency of Canada. I will also acknowledge that myself, as well as McMaster University, where we are hosted, is located on the traditional territories of the Mississauga and Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. So for today's webinar, we will be doing a quick introduction to the National Collaborating Centers and the NCCMT. We will be discussing what is evidence-informed decision-making in public health. We will then go on to get our student perspectives regarding resources to support evidence-informed practice. And as I mentioned, we do have a dedicated Q&A session towards the end of the webinar. With regards to today's learning objectives, for all of you who are attending, hopefully by the end of the session, you are able to recognize the key features of a model for evidence-informed decision-making, as well as processes for EIDM in public health. You should be able to know where to access tools and resources to support EIDM in public health and your ability to use the best available research evidence in decision-making. And lastly, you should appreciate the perspectives of current and recent public health graduate students on the value of EIDM and related tools that they have found helpful throughout their studies or their careers. So with that, we will launch our very first polling question for the session. With this poll, we just want to know, have you visited the NCCMT before? Have you checked out our website? I'm sure many of you are likely new to our organization if you're students. But if you have, how many times have you used those resources? So we'll just give a couple minutes for people to complete that. And it is looking like actually quite a few people have been to our website before, which is great, or you have used our resources, which is really great to see. And some of you have even used our resources over 10 times. That's definitely great. Okay, awesome. You can continue to answer that, but I am going to continue to move on. So the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers located across Canada. Our center is located at McMaster University in Hamilton, and our goal is to support public health professionals and organizations to use evidence-informed decision-making in their practice. The other 5 NCCs focus on different topics in public health. There's the Collaborating Center for Environmental Health in Vancouver, as well as the National Collaborating Center for Indigenous Health in Prince George, BC. We have the National Collaborating Center for Infectious Diseases in Winnipeg, the Center for Healthy Public Policy in Montreal, and then the Center for the Determinants of Health in Antigonish, Nova Scotia. If any of those topics you're interested in any of those, or if any of those stood out to you, I do definitely encourage you to check out their websites to get more information on those collaborating centers. Our center, the Center for Methods and Tools, as I said, we facilitate and scale evidence-informed decision-making for public health organizations. We do this by providing high-quality resources, real-world training, and practical mentorship that respond to the evolving needs of public health. And our goal is to advance a stronger public health driven by the best available evidence in order to improve the health and well-being of every person living in Canada. So without further ado, I am pleased to introduce our facilitator for today's session. Susan Snelling is a senior knowledge translation specialist here at the NCCMT. She supports outreach to the NCCMT's audiences, including our graduate training programs and public health professionals. Prior to joining the NCCMT, Susan worked for 10 years at the Sudbury and District Health Unit as a manager of research and evaluation. And she has also worked at Public Health Ontario, providing training and consultation on health promotion evaluation. I am very excited to have Susan here and to be facilitating this webinar. So without any further delay, I will pass it over to Susan to lead us through today's session.
Great. Thank you, Alana, and hi, everyone. Really great to be delivering this webinar once again. We do this every year. We have done for a few years, and it's really an opportunity to kind of go to the source of what we're trying to do as we're sharing resources, specifically with graduate students, and PhD students in particular, but of course relevant to other fields as well. There's lots that I could tell you about these resources, but it's always even better to hear from people who are students right now or have just completed their graduate studies, because they can tell you really what they have found most helpful, and you'll learn a little bit about their backgrounds, their journeys into public health. So one of the things that we've kind of been talking around as we introduce the NCCMT is this concept of evidence-informed public health or evidence-informed decision-making. That's really our focus at NCCMT. And so helpful maybe to have a definition of what we're talking about with evidence-informed public health. So you can read it on the screen. The process of distilling and disseminating the best available evidence from research and context and experience, and using that evidence to inform and improve public health practice and policy. So the way we think about evidence-informed public health is that there's sort of that scholarly aspect of finding the research and understanding that, but also a very active component to applying what we learn from the evidence to whatever situations we find ourselves in. Another way of thinking about evidence-informed public health is that it means finding, using, and sharing what works in public health. So as we think about doing exactly that, one of the resources that we share and talk about quite a bit at the National Collaborating Centre for Methods and Tools is what we call this wheel model. So these are stages in the process of evidence-informed public health. If you want to be doing evidence-informed public health, and I suspect you do because you're here, it's helpful to have skills in all of these steps of exploring evidence through this model. So we tend to start at the top, although it is a wheel, so you can jump in anywhere. But there are some skills with respect to just defining what the question is. That is, what evidence are you actually looking for? Most of you have probably used search engines, library databases, and so on. So you know already that you need to be fairly specific in what you're asking so that what you are thinking you want to know can actually be translated to that search engine or that database and help you find what is available for your specific question. So some skills with respect to defining, and then some skills with respect to the actual searching, where to look, and so on. And then we kind of go through the rest of these stages to think about what we're finding, how we appraise the quality of that evidence, how we can bring it all together. We often have more than one source of information, and so how do we kind of put that all together so that we come up with an answer that's actionable and that we can move forward with? Sometimes what we find with respect to what works in public health needs to be adapted for our specific setting, the populations we're working with, our context, how big a problem is this particular issue in our environment. So there's that process of adapting what we learn from the evidence to our specific settings. Then there's the actual process of implementation, getting where the rubber hits the road, so to speak. So actually putting that evidence to work to guide what we're going to do in public health. Then that question of evaluation. Did it work? Who did it work for? How well did it work? And we build our learning that way so that as we go on to ask other questions and go on around the wheel, we actually have built up some knowledge and some experience as well. So this model, and there's lots more about this model and lots of other resources on the NCCMT website, is kind of a broken down way of thinking about what goes into evidence-informed decision-making in public health. Another model that we find helpful at NCCMT to think about how evidence can help us do the work that we do in public health is this one. We call it the bubble model for reasons that are probably obvious. A lot of what we focus on when we're starting to define and search and appraise evidence is in the bottom left, the research evidence bubble. So, we go to scholarly publications, journals, and so on to see what they're telling us about what works on the specific public health problem or question that we have. But we recognize that there are lots of sources of evidence, and not all of them are based on research. Not all of them are found in journal articles. So we can also think about other sources of evidence that come into our decision making. Those can be sources of information about community health issues and local context, what's going on in our environment, what programs are already there, which might be different from a neighboring community, who's living in our community, what are their priorities. All of these are pieces of evidence, too, that we want to consider as we make a decision about what's best to do in our context. We also think about community and political preferences and actions. So sometimes there are policy windows where something's getting a lot of attention. That's an opportunity to make some progress on an issue. Sometimes some communities will be very accepting of a certain kind of intervention, whereas for another community that would not be acceptable. So we take that evidence into account as well. And you can have the best intervention in the world, but if you don't have the people or don't have the money to be able to do that effectively, that won't be a successful intervention for your context. So we also take public health resources as another type of evidence that comes into that overall decision about what's going to be the best thing to do in our communities. And then bringing all of that together is our public health expertise, and we can draw on the expertise of our partners as well to help us make the best decisions that we possibly can about what to do to address public health challenges wherever we may find ourselves. So that's just some background as to, what we're talking about when we talk about an evidence-informed approach to public health or evidence-informed decision-making. It's a real pleasure to introduce our two presenters today, and I'll let them introduce themselves in just a moment. But a big welcome to Sophia Caldwell and Alicia Gohar, who are going to be sharing some of their perspectives on why evidence-informed decision-making is important. Why should you worry about building these skills and becoming familiar with these resources? And also some of the specific resources that have been helpful for them. So with that, I'm going to first ask Sophia to introduce herself.
Thank you, Susan. Hi, everyone. My name's Sophia. I did my undergrad at the University of Guelph. I majored in biology and I did a minor in nutrition as well. I made those decisions without having any clue of what I wanted to do. But then during the pandemic, I ended up getting a job with Public Health Ontario, just with their logistics team, where I was helping pack up COVID-19 testing kits for health units and public health units, which is where I really got to learn more about public health and became more interested in pursuing it academically, which led me to doing my Master's of Public Health at Brock University, which I just graduated from. Brock's program was really great and flexible, completely online and asynchronous, which I really loved. And then for my practicum placement as part of my master's, I was a research assistant with the National Collaborating Center for Methods and Tools. And during that practicum placement, I worked on lots of little aspects, evaluation projects with health evidence as well, mostly with the Rapid Evidence Service, where we work with internal and external partners to create reviews, answering really specific research questions. And I was given the opportunity to extend my contract as well. So now I work full-time still as a research assistant, where I'm more heavily involved in other areas of the NCCMT, like communications. And yeah, it's been a really great opportunity, and I'm loving the work that I do.
Well, that's wonderful, and we love having you. So thank you, Sophia. Can you just say a little bit, Sophia, because I'm sure people are interested in how you actually um, uh, found found your way to the practicum at NCCMT? What was your process for finding that?
Yeah, so I know each school is a little bit different, but with Brock, it was pretty much an independent process of finding your practicum placement. We had kind of a job board where um, job postings were posted for us to apply, but we had to interview and find them on our own. So I kind of took it upon myself to go even past those postings because the NCCMT actually wasn't even posted because they didn't have a specific job application open. So I actually just was researching organizations that I had learned about through school, and just checking out their websites and things like that. And the NCCMT's just has a little blurb about contacting to inquire about opportunities. So that's what I did. And they ended up having an opening for a practicum placement. So yeah, I think my advice there is um, going beyond just job postings and just trying to reach out to organizations that you know of just to inquire about any potential opportunities.
Great advice. I'm glad that worked out for you too. That's super. Thank you, Sophia. So we'll hear more from Sophia in just a moment, but also just want to give Alicia Gohar an opportunity to introduce herself. Alicia.
Thank you, Susan. Hi, everyone. It's really great to be here today with you guys. A little bit about myself. I did my undergrad at McMaster University in life science and did 2 minors, one in political science and one in interdisciplinary sustainability. I'm currently finishing up my Master's of Public Health degree at the University of Waterloo. I did my practicum at Public Health Ontario in the Environmental and Occupational Health Department, and I've been a research assistant with the NCCMT since November of 2023, working with health evidence.
Great. Well, and once again, that's wonderful for us to have you with us. Can you say a little more, Alicia, about how you ended up doing the practicum at Public Health Ontario?
For sure. So, like Sophia, it was kind of a bit of an independent process, and I applied for my practicum through PHO's external site. So they post summer practicum placements in, I believe it's February or end of January, and I interviewed with them and got the position that way. With my experience when I started my search, I found it kind of overwhelming to figure out what my options were, like what organizations were actually out there to do a practicum with. So I found it helpful to create a list of organizations like over time, maybe the semester before, of where I'd like to work and grow that list based off of where my peers were working or other organizations that I'd heard of through school or otherwise, and checking their websites frequently for postings. If the website kind of has like a contact information or for further inquiries, reaching out in advance to kind of see whether they had any opportunities available for the semester that I was interested in as well. And I know with the University of Waterloo, there's a list available for MPH students to check where previous cohorts had done their practicums. So that was also a really useful resource to kind of look at what the options are, both for practicums and for employment.
Great, super helpful, I'm sure, to people who are maybe trying to navigate that or will need to navigate that. So thank you both for those introductions. So in terms of, the core of this webinar, we asked a couple of questions to our presenters. And the first question we asked is, how are evidence-informed decision-making skills important in your studies or your work in the public health field? So we'll go first to Sophia, just to hear a little bit more about, from your perspective now, having done a bit of work in the public health field too, how are evidence-informed decision-making skills important?
Yeah, for me, I think the big thing about EIDM is that it kind of makes every step easier in the process of research. It makes it less daunting by breaking it down into those specific, succinct steps, and provides the tools to help you through each of the steps. I personally had almost zero research experience going into my practicum. And I actually voiced that during my interview and told them that I really wanted to become hands-on with that. And EIDM has been that kind of stepping stone into research. It's been really helpful. And specifically in the rapid evidence service, where we create these reviews and working with external partners a lot of the time with stricter deadlines. EIDM tools, especially quality appraisal tools, really help make that process as efficient as possible, and also shows to our partners that we are synthesizing the best available evidence to answer their research question. And the other huge part of EIDM for me is helping differentiate between high quality and low quality evidence. This was another thing that kind of I was never really taught. I assumed that as long as something was published in a journal, that it had to have been of high quality. But I've learned through my time at the NCCMT that this isn't the case. There's unfortunately a lot of bias and a lot of skipping steps in terms of quality, even in published papers. And EIDM tools, especially quality appraisal tools, really, really helps in showing that and what kinds of research are actually going to make an impact, needed to bridge the gap kind of between research to policy and policy to practice. And yeah, just as future public health workers, it's really great to be aware of these tools and processes, just because they do help in kind of translating the evidence out there and synthesizing it into those actionable outcomes that are going to be influential enough for stakeholders and decision makers that we're trying to influence.
Yeah, great, Sophia. Thank you. That's really helpful context. What about for you, Alicia? How have you found that evidence-informed decision-making skills have been important in what you've been doing?
For sure, they've been very important, both in the schoolwork that I'm doing for my master's degree and also the practicum and research projects that I've worked on outside of academia, kind of. For me, the most important application of EIDM skills is like the holistic approach that it applies to analyzing topics, that especially topics that you may not have a lot of exposure to. So with a lot of courses, if you're kind of doing a research project or doing an assignment on a topic that you may not know all the policy options for or all the recommendations that are out there for it, applying the EIDM skills to kind of collect that information is really, really helpful. And as everyone mentioned, going beyond those published studies and including other forms of information that I hadn't really thought of would count as kind of good evidence. So like expert opinion or raw data, for example. And then with a better understanding of just the evidence that's out there, you are able to create stronger arguments, which result in stronger assignments and better grades. And in the research projects that I've worked on as well, the EIDM approach is kind of the first step that's used to create research questions, and it really does influence the directions that papers go to as well. So it's really been my experience in academia, the starting point of all projects, and using it to make policy and research recommendations allow for you to make them more relevant and specific. Especially in my work experience, not all of the information that's available is published. And then in particular with some of my research experience, by the time that information is published, it may be considered outdated. So knowing how to find that evidence and make decisions on tighter timelines, but ensuring that that evidence is of high quality is a really important skill that EIDM contributes to. And then just connecting it to my practicum, those skills outline how to collect information and broaden evidence that I'm studying and connect it to like local, international, economic, political fields that you maybe hadn't considered with your understanding of the topic at hand and your understanding through just published articles. And those real world connections, not only just to collect evidence, but also appraise them is especially important, I think, when you're working kind of in your public health career.
Great. Thank you, Alicia, and thank you both. It's it's important, I think, to think about, as both of you reflected, that as we're kind of diving into evidence, for sure it has these scholarly aspects to it. You're doing an assignment or you're writing a report or something like that. But there's still that aspect of that this might be used to make an actual decision or, like do something actually in the world. So it's got that connection to practice, which is an important part of evidence-informed decision making. We're making decisions that actually have implications. So great to hear about that from both of your perspectives. The next question that we had for our panelists was about specific resources. So, let's get down to it. Evidence-informed decision-making resources that, have been useful as you're undertaking some of these projects or skills or assignments. So we asked for a few things, and so we'll go first to Sophia to talk about online learning modules that are available through NCCMT.
Yeah, the online learning modules are a great foundational learning. I did them as a part of my onboarding during my practicum. I wasn't aware of them before that, but they're a great intro into what we're talking about, into EIDM. And they're also just kind of a great internal assessment to kind of show yourself what you already know, what areas you'd like to expand on, which areas you want to work on, and which areas you can build on. And they're broken up into really specific areas that you can choose. They each only take a couple hours to complete, and you can save your progress and come back to them. And yeah, they're very useful depending on which area of EIDM you want to take a further look into.
Thanks for pointing that one out. And of course, it's you know, it's nice for the presenters to be able to share these resources with folks, even when maybe you didn't know about them when you were in school, but you know, maybe others can kind of learn from that and find out about these things a little bit earlier, like with this one. So yeah, lots here with the online learning modules for sure. So let's hear from Alicia about a resource that you have found helpful, and that's the Registry of Methods and Tools. So we can go to the next slide, I think, and hear from Alicia.
I actually put the registry as my tool, or I don't know if we both put it. Alicia? Okay, I'll go ahead.
Okay.
Yeah, the Registry of Methods and Tools was something I discovered during my master's when I first kind of got introduced to the NCCMT in general. One of my classes and professors really focused on the NCCMT, and we actually did an assignment where we evaluated a tool within the registry. And yeah, that assignment gave me the opportunity to explore it and just kind of poke around and see what's available in terms of methods and tools. Since it's separated into the 7 steps here, the wheel that we mentioned of EIDM, and also by methods and tools right below the wheel, it makes it really easy, even as a complete beginner, to find useful resources that you didn't even know existed. It's a really great foundational resource, I think, if you're not sure exactly what tools you need or what the most effective process is going to be to reach your respective goals, because you can search through the steps or through methods and tools. And it's an overall great educational tool if you want to just use it to look around and give you a better sense of EIDM, or to use it in research for class. It has a lot of really great methods and tools to evaluate. And then on the working side, for when in actual public health work, using the provided tools to reach your specific goals.
Yeah, thanks for talking about this. So the Registry of Methods and Tools, I mean, there's lots there, and certainly at NCCMT, we recognize that there are so many methods and tools out there that can support people who are doing different aspects of evidence-informed decision making, that it's just helpful to be able to have one source to sort of find out what's out there for the different steps, and you'll see the wheel there again. So yeah, it's you know, there's for sure lots in the Registry of Methods and Tools to explore. So let's uh, Alana, if we can just go back to the online learning modules slide, and I just want to see if there's more you've used those modules as well.
So I can, so I can add just a little bit more to what Sophia said about the online learning modules, and she did a great job summarizing kind of the tool itself. So the only thing I kind of wanted to add was that the modules are free and they're self-paced on a variety of topics, as you can see, on quantitative research designs or critical appraisal of different study types like intervention studies or systematic reviews. Some of the modules also generate certificates if you achieve a passing grade as well. And the modules have examples where you can practice applying what you've learned, and you can always go back to them on your dashboard with your results. So if you need a refresher, they're always there to use. I think one of the greatest things about the online learning modules is They have a great learning needs assessment quiz that can help you make the best use of the modules and really hone in kind of what skills you could develop through the NCCMT's resources. And yeah, the modules are a really great way to build kind of your professional development skills, and could be useful in a job setting, especially in a research-based role as well.
Super, thank you. Some good perspectives on how these modules can be useful. So thank you for that. Alicia, why don't we stick with you and we'll talk about the next one, which is health evidence.
For sure. So this is a database I'm very familiar with. So my role at the NCCMT is providing the first round of quality assessments for studies before they're published onto the registry. So health evidence is a free repository that holds completed and in-progress rapid evidence reviews focused on a huge variety of public health topics. So anything from COVID, aging and wellness, mental health, cost evaluations. There's a lot. So it evaluates the effectiveness of public health and health promotion interventions by having 2 independent reviewers critically appraise all of the reviews according to criteria that's provided by the NCCMT to provide an overall quality score, which ranges from 1 to 10, with 10 being of highest quality. So my role is as one of those reviewers. And this resource saved me a lot of time when researching topics for my MPH classes. You can basically go into the search bar and type in a topic like oral health, for example, and the results will be all of the systematic reviews that have been appraised that are related to that topic. So you can filter by study population, looking for studies that are only in children or older individuals, or intervention types like surveillance or immunization. So there's a lot of variety and a lot of options. It's a great way to familiarize yourself with the topic. And you can also look at whether some of the resources that you're using for your own research and assignments have been appraised on the HE website, and what rating was given to ensure that the data you're referring to is of higher quality. So it helps you assess kind of whether the quality of the review is high enough to inform decision making adequately, and whether the authors who compiled the information considered certain aspects to ensure like high quality as well, and it's a true reflection of the topic that's being studied. And then learning the way that health evidence appraises data is useful as well. So kind of going beyond the score that was just given, you can ask questions. It allows you to like ask questions that the NCCMT asks when scoring the reviews, and apply kind of their methodology onto other articles of research or on other work outside of a repository, outside of an academic setting, and kind of gives you that critical skill to kind of ask the same kind of questions when you're looking at the quality of evidence kind of outside of academia.
Yeah, great, Alicia. Thank you for talking about that. And you know, I wonder from your perspective, as you're doing a lot of this critical appraisal of these systematic reviews, you know, I think one of the surprising things that we heard about earlier is that surprise, things that are published are not always of really the highest quality. Was that a bit of an eye-opener for you as you really have started to dig into some of the quality appraisals of these reviews?
It definitely was a surprise. As you mentioned, not all published reviews are created equally. There's a lot of, I think, nuance just based on the topic as well, and based on kind of how the authors approached the review as well. But it was really surprising when you kind of look through those questions and ask yourself whether the authors actually took the time to you know, whether it was appropriate to compile the data in the way that they did, whether there was an independent kind of a review of extraction and an independent quality appraisal done by authors. It's really interesting to see kind of how things are worded within the published studies as well, what techniques were used. And something that I learned was the supplemental data that's added. That's not something that I would usually gravitate towards when I was reading published articles, kind of just focus on what's within the body, but kind of the supplemental data, kind of the evidence that they've tacked on to their paper is really important when determining whether it's of high quality as well. It can really help kind of add that extra piece.
Yeah, thank you. That's some, some tips from someone who's kind of in the weeds of it, doing those reviews. So thank you for that, Alicia. Let's go to our next resource to share, and we'll have Sophia talk about this algorithm for classifying the study design of primary studies. Over to you, Sophia.
Thank you. Yeah, I discovered this tool only after starting at the NCCMT, but this is one that I definitely wish I had known about sooner, because I think it can definitely be really helpful, not just for work, but for school. Yeah, the tool is basically just kind of a decision tree, and it takes you through yes or no questions based off the study you're using. And it offers a lot of guidance on what to look for in terms of figuring out the study design. It's very user-friendly, very easy to follow. And I wish I'd known about it during undergrad and master's, because knowing and understanding the elements of a studies design is so relevant, especially for classes like epidemiology, where we're tested on differentiating between study designs and those key components, like intervention, exposure, temporal sequence, things like that, which all affect the quality of a study a lot. And this tool is also really, really relevant with my work and research and screening, especially when we're doing reviews and systematic reviews, where there's really specific inclusion and exclusion criteria. And a lot of the time, we want to limit the types of studies that are included in a review to specific study designs. So using this tool is very, very useful in that area where screening studies is dependent on the actual design of the study. And also very helpful to use in quality appraisal efforts, because there are a lot of quality appraisal tools out there that are specific to study design and that are only appropriate to use for specific study designs. So using this tool to figure out what that study design is, whether it's cohort, case control, RCT, it's a great first step in figuring that out, so that you can appropriately quality appraise.
Yeah, thank you for that. I mean, there's so much of what we need to do when we're trying to unpack research evidence and really make it work for us that relies on just understanding what we're looking at, and some of the strengths and weaknesses, leading into the critical appraisal. All of that really comes down to having a good grasp of research design. So yeah, some great examples from your perspective, Sophia, of just how that can be useful, to have this process for helping you to figure that out. So thanks for sharing that one. Let's go to the next resource, which is the Rapid Review Guidebook. And Alicia, do you want to talk about this one?
For sure. So rapid reviews are a particularly useful skill to have in public health because they allow you to get a quick snapshot of the current evidence that's available in situations where maybe conducting a systematic review might be difficult to do because of time or otherwise. So rapid reviews are different than systematic reviews, which were kind of the only kind of review I was exposed to before working with the NCCMT and before my master's program as well. So the guidebook gives a really comprehensive step-by-step guide going through the key aspects and considerations when writing a rapid review. So there's mention of considering social determinants of health, for example, using PICO, which for those that don't know stands for Population Intervention Comparator and Outcomes. And these are 4 factors that should be considered and mentioned when defining a research or practice question. Prior to starting my MPH degree, I didn't really know that. I didn't know that there was a specific tool that could kind of check that off just for the question as well. The guidebook was a really quick way for me to ensure that I was including everything I needed before submitting assignments that were related to rapid reviews, kind of similar to a rubric in school, and it was a great way to ensure that I was meeting expectations when writing a review. And as mentioned already with what I mentioned with health evidence, the repository, looking at the factors that made a good quality assessment familiarized me with how to critically appraise work outside of the academic setting. So similarly, looking at kind of the steps that are in a good rapid review familiarized myself with what should be included when I'm trying to use other published reviews as evidence for my own research, or asking questions about how evidence was synthesized, how recent it is, where information was collected from, in my practicum and in my work experience, to ensure that the sources had kind of everything that should be included and were asking the right questions, and that the review was of high quality.
Yeah, thank you, Alicia. You know, so much of what we've been doing at NCCMT, certainly recently, so I would say, you know, during the COVID-19 pandemic, we started doing a lot more of these rapid evidence reviews. And so, you know, it's been such a cornerstone, I think, of the kinds of things that people in public health are looking for. Rapid reviews to answer specific questions about public health practice. So knowing how to do a rapid review, but even just knowing the components of a good rapid review so that you can, you know, have a better understanding of whether other people have done, you know, the right things, I think is really an important thing. So thanks for drawing our attention to that one. So we do have some opportunity for questions and answers. So anyone, participants on the line, if you would like to use the Q&A to type in any questions or observations that you have, we're happy to take those now. You've heard Sophia and Alicia talk about, you know, sort of their backgrounds and kind of how they found their way into public health, into the specific practica that they did, and then the work that they've been undertaking. And then you've heard them talk about some of these resources that either they knew about and benefited from in their studies, or things that maybe they wish they had known. So happy to hear your questions or comments if you have any. And we'll just take a moment to see if there are any questions to bring up right now. I wonder, so while we're waiting, just Sophia and Alicia, I'll just ask both of you to just think about, uh, you know, what is it that really makes you interested in public health, you know, as a field of study or a field of work? You know, there are lots of aspects, of course, to public health. There's lots of variety in it. What is it that kind of attracts you to working in this area? Maybe Sophia, I'll go to you first.
Yeah, I think a big part of it that I've kind of learned through my practicum, which was kind of an opportunity to see if I did enjoy the work, which I learned that I do through kind of the aspect of everything being project-based, which I really love. And it was a very big difference from the usual jobs that I was taking on before my master's, where it's kind of daily repetitive tasks. I think that project-based work with evidence and research is very impactful and takes kind of a while to develop, which can be challenging. But in the end, when you get the result of a finished knowledge product or anything that's going to be disseminated, it's kind of really fascinating to have something that you put work into and it's being disseminated and hopefully making an impact on the public.
Yeah, it's great, isn't it, to have that feeling that you've sort of like gone through a process and coming out at the end with a product that might actually have an impact on a decision or on population health. So yeah, thanks for sharing that. What about you, Alicia? What attracts you to working in public health?
For me, I think because I was kind of introduced to public health at the end of my undergraduate degree, I kind of really didn't know about it until the final 2 years. And COVID was something that really helped my understanding of the public health field. I think what was interesting for me was I had an interest and had studied political science to some degree in undergrad as well, and realizing that with public health, it's connected to so many different disciplines and it's connected to so many different topics. It really kind of goes beyond maybe the more clinical or academic settings that we're used to. And as Sophia said, being part of a project that goes off the page, so to speak, and is implemented to help the community was a really big factor into my interest in public health. Just with my previous experiences, all of the research projects that I've worked on, and it's about 4 or 5 now, they've all been on very different topics. So that's another thing that I really love about public health is your opportunity to expand and to kind of explore different areas of expertise and gain skills kind of on different topics is so vast. And it really kind of is limitless in the sense that public health is kind of related to every single discipline. It's a great opportunity, I think, outside of academia and outside of clinical study to interact with interdisciplinary teams as well and share kind of your knowledge on a more holistic and upstream kind of intervention approach. So that's what got me interested in public health, and I'm definitely glad that I pursued it and I'm here today.
Yeah, that's awesome. Yeah, lots of variety, that's for sure. So I don't see any other questions coming in, so maybe we'll just move on to just touch on a few things before we wrap up. So I'll turn it back to Elena after I say a big thank you to Sophia and Alicia for sharing their experience and being willing to kind of open up a little bit and let people learn from what you've gone through and some of the resources that you've used. So thank you very much. And back to you, Alana.
Thank you, Susan, and thank you, Alicia and Sophia, for sharing your perspectives on EIDM and tools to support EIDM. As we're wrapping up today's session, I'm hoping that those of you who are attending are interested in maybe learning more about the NCCMT or EIDM in general. If that is you, there are lots of things you can do to kind of kickstart your EIDM journey. Connect with us on social media. So please add us on LinkedIn, add us on Twitter. We do actively post on both of those sites. I would say register for another webinar, but I think this is the last one we have planned for the calendar year. However, we do have a workshop series going on. So if you're interested in doing a little bit more in-depth EIDM learning, you can definitely check out our website to learn more about those workshops. If you're new to EIDM, I would definitely direct you to taking our learning needs assessment. This is a 20-question multiple choice test that will kind of give you a good benchmark of where you are with evidence-informed decision making and where you could maybe learn a little bit more. As Alicia and Sophia talked about, maybe try an online learning module. These are a great way to build your EIDM skills and learn a little bit more. As well as check out our Understanding Research Evidence videos. These are short YouTube videos that provide really great introductions to different evidence-informed decision-making concepts. I will also direct you to our NCCMT user dashboard. So this is a fairly new application we have on our website where you can track your success and your progress as you work through different training opportunities on our website. You also have the ability to build an EIDM toolkit. You can save resources. This is completely free. All you have to do is sign up at nccmt.ca. So I think with our last couple of minutes, we will have Krishan launch our final poll for the webinar. This is to help gauge a little bit of feedback as to how this session went, whether or not you enjoyed it. And we really do use this feedback to inform our webinar series for going forward. So we would appreciate you taking the couple minutes just to complete that. Otherwise, as you're filling that out, please check out our website. If you have any additional comments or questions, please feel free to reach out to us at nccmt@mcmaster.ca. And if you would like a copy of the webinar slides, you can also contact us at that email to get a copy of those. If you're interested in learning more about the NCCMT or EIDM in general, again, just feel free to reach out to us and somebody will get back to you. We are very responsive, so you can usually expect to get a response in about a day or two. Otherwise, I think we are good to log off. And again, I want to say thank you to Susan and thank you to Sophia and Alicia for being here. And thank you for everyone who logged on. And hopefully you all learned a little bit more about evidence-informed decision making. So thank you. Bye.